Hello, this is Dr. Ashok Modi, consultant pediatrician, Bhagirathi Neotia Hospital. Today I'm going to talk about fever, which is a very common problem. A lot of parents come to us with fever, but strangely, some parents don't even record the temperature. So I think it's very important. You need to know that just warm babies do not mean fever. It's very important you record the temperature, and if the temperature is more than 100 or more, then only it's fever. That's how we define fever. So always to check the temperature with a proper thermometer. In young children, it's best to check it under the arm. In older children, it can be measured inside the mouth. But if it's a mercury thermometer, you should wait at least 3 minutes. But the electronic thermometers usually give you a beep to tell you that the temperature has been recorded. So it's very important to measure the temperature properly. And there are a lot of reasons for fever. So it could be just infection, but there could be other non-infectious causes of fever. So it's very important that when you have child have a fever, you record it on a piece of paper so that we can see the pattern, and it helps us to make a diagnosis for the cause of the fever. Now, height of the fever doesn't necessarily mean higher the temperature, the worse the disease is. A viral fever can have very high fever, whereas a serious disease can have low fever. So, height of the fever doesn't tell you. And the other thing which is important is how the child is in between the febrile episodes. If the child is well in between the febrile episodes, then likely to be nothing major serious. Now, when do you need to see a doctor? You don't need to go to a doctor immediately the child develops a fever. It's only if the child is very unwell, and especially children who are less than 3 months, and if the child is having very drowsy, or is headache, severe headache, or having convulsions. It could be unusual rash. If you have breathing problem, chest pain, abdominal pain, passing very little urine, very dehydrated, then you need to see the doctor urgently or even take to the emergency. So these are basically the red flag signs or the warning signs to tell you that something serious might be wrong with the child. And how do you manage the fever? Most of the parents is basically panic. But what you need to do is overwrap the children. So you should not overwrap the children. That's the basic thing. You should make them wear minimum clothes, cotton clothes, keep the room temperature relatively cool with even fan or AC if required. And you can give them a sponge or bath with lukewarm water. You should not use cold water at any stage. The other thing is to give them plenty of fluids, because if the child is dehydrated, none of the fever medicines will work. So it's very important to give plenty of fluid, and the best thing is to give them paracetamol, and ibugesic, ibuprofen should be avoided if at all possible. So you should manage the children, and you should take the children after 2 to 3 days if the fever doesn't settle in 2 to 3 days, or if the child has any warning signs as I explained earlier. And these are the basic few facts you should remember when your child has fever. Thank you so much.